Welcome back. Now, Nigeria is grappling with a worrying case of drug abuse, especially among its young people. And this is despite the best efforts of the country's anti-narcotic agency, the National Drug Law Enforcement Agency, NDLEA, to check the menace. The agency is proposing to adopt a definitive approach to tackle the crisis. Now, it is partnering with the Federal Ministry of Education to implement a compulsory drug integrity test for students in tertiary institutions. So the Minister of Education has now announced the introduction of mandatory and random drug integrity tests for students in tertiary institutions in the country. This includes new students, returning students, and randomly selected individuals. The strategy, of course, is aimed at curbing drug addiction in Nigerian higher institutions. And I can tell you, it's a very big problem. Chairman of the National Drug Law Enforcement Agency, Buba Marwa, has commended the Minister of Education for taking the proactive approach to addressing the critical issues now in the education sector, drawing urgent attention to the escalating drug abuse crisis among Nigerian youths, calling it a battle for the very soul of the next generation. Well, joining me right now to shed more light on this new drug policy, if you like, is Femi Babafemi, who is the Director of Media and Advocacy of NDLEA. Thank you very much, Mr. Babafemi, for joining us on the program. First off, this plan to endorse compulsory and random drug testing of students in tertiary institutions is reportedly part of a three-pronged strategy that also involves revising drug education in schools, introducing standalone prevention programs in secondary schools. Could you explain now the key reasons behind this decision?
Okay, I think I got quite well the first part of your question, which is the justification for the introduction of compulsory and random drug test for students of tertiary institutions. Now, I'll tell you, we have to look at first the basis. What is the drug situation in Nigeria like? As at 2018, when a report on the National Drug Use Survey was published in Nigeria, we have a population of 14.3 million Nigerians who had abused illicit substances other than tobacco and alcohol. And these were people within the age bracket of 15 and 64. That was as at 2018. Now, 7 years after, you can just imagine what the situation will be like now, because quite a lot of the factors responsible, what we call the causative or predisposing factors, are still largely around with us. Now, that shows that we have a huge population of people who use illicit substances, and that if you put it at if you put that relatively to what happens globally, that gives us 14.4% prevalence average, which is almost 3 times the global average of 5.6. That's bad enough. And if you look at the population of those who use the most commonly abused illicit substances, according to that survey report, that puts that's 10.6 million people who abuse cannabis. As at 2018, the population of Poland was put at 10.2 million. That's a European country, 10.2 million as at 2018. Whereas here we have 10.6 million who abuse cannabis alone. Why I'm saying all of this, putting this background, is to establish the fact that indeed we have a very bad situation in our hands. That's painting a grim picture. That survey report painted a grim picture of what the drug situation in Nigeria is like. And so there has to be a lot of strategies, there has to be a lot of initiatives put into it to ensure that both at the level of drug demand reduction and at the level of drug supply reduction. And that's exactly where we are, where we are today, trying to do everything possible to ensure that we cut down access to these illicit substances. And that's why you would have seen that the NDLEA has been ferocious all across the country in its efforts, in its enforcement activities to ensure that we mop up whatever is available out there. And I tell you that in the last couple of months, we've had more than 67,000 arrests and more than 11.2 million kilograms of assorted illicit substances mopped up from our streets. That's settled. Now, that's on the supply reduction. Now, when you now look at on the demand reduction, I will also tell you that the agency has been trying to introduce a lot of initiatives, starting from awareness creation, sensitization. That's why we have War Against Drug Abuse. That's WADA, social advocacy initiative to mobilize everybody to buy in and take ownership. That is first raising the awareness of the people to the dangers of abusing illicit substances. And that's why every week the agency, commands across the country, goes to schools, marketplaces, motor parks, communities, palaces of traditional rulers, and all, including faith-based worship centers, that is churches, mosques, and all of this, to raise awareness in conjunction with non-governmental organizations, civil society organizations, faith-based organizations, community-based organizations. And in the case of when you have people who still fall into the trap of abusing these substances, we also have systems in place to ensure that we attend to them and all of that. But now, having done all of those things, we have to look at, okay, the problem is not as if we are not, yeah, there have been a lot of sensitization, there have been a lot of awareness creation. People are now more aware about the dangers of substance abuse. And we also to look at it again, what more can we do? And that brought about the Save Our Families campaign, that is SOF, which is driving the drug testing process. That is to ensure that, okay, another thing we can do is to ensure that we introduce drug testing. First, what that does is to early detection. When young people, especially our young people, have started experimenting with illicit substances, when they are tested early and discovered, that is when they test positive, then we'll be able to provide them early support, that is treatment, counseling and treatment. At that point, it's better. I mean, it's less complicated. We're not having the issue of addiction. We're not having the issue of dependence at that level, which is far better to manage and get people off these illicit substances, other than waiting until the whole matter becomes complicated and then people are already addicted to these illicit substances. So that's one of the reasons, that's one of the justification for pushing for the adoption of this drug test in our tertiary institutions. But let's not miss the point that this is just one segment. We're pushing this across all strata of the society, starting from the families. We're asking parents also, right in your homes, you can get drug test kits, just like you do you have machines in the house, systems in the house to test blood pressure, to test sugar level. So also buy drug test kits so that you can test your kids when you are in doubt or when you are suspecting them that they are already abusing illicit substances. So introducing this within the tertiary institution is not actually something new. It's something that has started, because don't forget that we started this, the advocacy for this, the push for this way back 2021. So it's not as if we're just getting the buy-in of the Federal Ministry of Education wholly at this point. So what this does, apart from detection, is also it also has its own deterrent effect, meaning that when students know that when, as fresh students, if you are given admission, if you have to resume, you will be asked to undertake a drug integrity test, that would deter you. That will tell you, oh no, if for me to be able to go ahead with my education, I have to stay off drugs, or I have to avoid anything that has to do with drugs. So that's a deterrence effect. And even at home, when kids also know that if they go out, mess up with their friends, when they get back home, there is the likelihood that their parents are going to subject them to drug tests. That would also deter them. So those are enough reasons for us to say, okay, yeah, this is good, this is a good strategy, let's deploy it. At least that will cut down on the demand for these illicit substances.
So how will the NDLEA and the Ministry of Education coordinate the rollout of this policy nationwide? Are there specific guidelines or operational framework now already in place to guide its implementation and ensure accuracy? And what specific substances now will the students be tested for?
Yeah, even though we have a technical working group in NDLEA and the Federal Ministry of Education working together on the modalities. But I can tell you that where this has been, in institutions where this has been going on already, I mean, it's don't forget that quite a lot of the institutions are already doing this. This is, like I said before, this is not something we just started pushing. This is something we have been pushing across all strata for the political class, for those who are planning to get married, for people who are getting jobs, for people even who are on the jobs. And it's what, even within NDLEA is what we do. We conduct random tests for officers, personnel, and we do that. It's also part of the process of recruitment into the agency. So it's not something new. And so in places where this is already going on, I can tell you that it's a public health thing. So it's something like you go for your medical checkup. So it's not, and I must clarify that this is not punitive at all. It has no, we're not expecting anybody who tests positive to be, for instance, students to be rusticated or to be sent out of job. No, that's not the motive. That's not the intention of this whole advocacy. The whole essence is to dictate early if individuals, even people who are applying for visa now, I mean, that's visa to some countries. There are some countries that now require visa clearance from NDLEA, and for you to get visa clearance at the NDLEA, you have to undergo drug integrity tests. So all of these are already, I mean, happening, and like I said, it's a medical thing, and it's not as if when an individual tests positive, will go public to announce. No, because it's a public health thing. When you go to hospital, you do test, nobody will come and announce that, oh, ABC has malaria or has IBP or has diabetes. No, this is private. This is a private thing. This is a private record just to start the process of treatment for the individual. So those are the things that have been going on in schools or in establishments or places where this policy has been adopted. It's a medical thing, just like you do your normal medical medical checkup. So that's the process. That's the modality in place. But then at this level, the one what we are doing with the Federal Ministry of Education, we have a technical working group on both sides that are already working together to develop a whole system, the modalities to be able to have a uniform process across all the platforms.
So will this drug testing policy apply to both public and private tertiary institutions? If not, what are the criteria now for determining which institutions will be included?
Yeah, this is a national policy. As long as you are operating in Nigeria, it's a national policy. It's something that definitely will apply to everybody. But don't forget, like I did say before, I know personally that there are quite a number of public schools and private schools that are already doing this. Even as we speak, we're having this done in some secondary schools already. And this is something that we intend to cascade down to even the elementary school over time. So it's something that it's already being done in both public and private and tertiary institutions.
Now, will parents and guardians be involved in this process? Specifically, with their consent, will their consent now be required, before this test is conducted on students?
That's why it's a policy, it's a government policy. It's already there. Like I said, this is not something that is being newly introduced. It's don't forget that when students go gain admission into schools, there is a portion there for medical checkup, for medical checks. Do you understand? There are medical examinations. All of these things are already. This is just added to what they undergo. Find out, check it in all the schools. There is no school that does not have this process. You have to, even if you are going for employment anywhere now, you are subjected to medical examination just to ascertain your fitness. And that is the same thing. That's what we are saying. This is medical. It has nothing. It's not something being done to stigmatize or vilify individuals. No, absolutely. So it's something that is being treated as a public health thing, and that's the way it's going to be handled. It's not something that the result will be announced to the public or to other students. No, it's something that is private between the individuals and the medical facility where they are going to be seeking treatment in those institutions. It's already going on, and it's been very seamless. There's no really a big issue in that. That, like I said, the records are private, they are confidential, and is nothing anybody should worry about.
So what about school administrators, counselors, teachers, and what have you? What role will they be playing in terms of supporting and facilitating the successful implementation of this policy?
Yeah, that definitely they are going to be. It's going to be administered by the officials of those institutions with the support of our agency. As like I said again, as it's being done at the moment, institutions already have clinics, hospitals where they are going to be introducing this, and we're going to be supporting them just like we've been doing with trainings. That's their officers. We're going to be supporting them with the appropriate trainings and be able to do this seamlessly. And so that's already in place, and we're going to be doing this for the benefit of everybody.
So how frequently will the drug test be conducted? I mean, is it going to be like a monthly thing, yearly? And also, will there be any legal consequences for students who refuse to undergo this testing? Because, of course, some students may just not want to do it. So what exactly, can you just shed more light on that?
No, it's a national policy. Like I said, there is no, it's something that is being done for the benefit of the individuals, for the benefit of the institution, and for the benefit of the parents of the individuals and the society as a whole. So it's not something that is that anybody is kicking against. There are quite a lot of state governments that even had already bought into this and championing it in their states with the support of the NDLA. So it's something that has been going on seamlessly without any resistance or without any issues raised from any quarter. So it's like I said again, we have to understand the fact that this is a public health thing. It's not something being done to stigmatize or vilify anybody, and it's also part of a system that the outcome cannot be public. And again, the individuals who test positive have to be helped. Don't forget that there are quite some of these people who are users, and they are still going to their classes. So what this does is to confirm, okay, this individual has this problem, so we have to put in place help, counseling, treatment for this individual. Just like you have malaria, you go to the hospital, you have a test, it's confirmed that you have malaria, and you are put on treatment. That doesn't still stop you from continuing to do what you are doing. That is whether you are going to school, you are going to classes, or you are going to your office or workplaces. So this is just exactly the same thing. It's just in line with all of the things that have been going on, or what we're already doing. So there is nothing out of place with it, and definitely it's in the interest of the individuals, the institutions, the parents, and the society and our country at large.
Now, how about cases where students unknowingly, because I mean this can happen, unknowingly now consume substances that cause, well, if you like, something like a false positive drug test? We see that with footballers. I mean, you know that. So how should schools respond to this in an ethical way?
No, there is no problem about that at all. Don't forget that I said this is not punitive. Even if you are discovered to be using even the illicit substances, nobody is going to punish you for that. Do you understand? So it's just to bring you help early enough. So if perhaps somebody has taken something, maybe a controlled substance, unknowingly, the test will show. Do you understand? And it will be examined to determine what exactly happened. Should this person go for treatment or counseling, or should this person just be allowed to continue without being subjected to further examination or treatment? So all those things, all those protocols are already in place, I mean, for medical examination and treatment. So it's really nothing to be worried about. I mean, since the outcome is not going to attract any penalty or any punishment per se, so there is really nothing to be worried whether, oh, the test will confirm the kind of substances in your system and whether it's a random thing or it's a regular consumption. So the test, I mean, we have, for instance, the NDLA test kits can detect as many as 15 substances. So it will show whether this is just something that was taken once, or something that an individual has been taking over time, or whether the individual has taken just only one substance, or there are more than 2, 3, 4 other substances in the system of the individual. So the test will indeed establish all of those things. So it's nothing for anybody to be worried about. That I can assure you.
Well, Femi Babafemi, Director of Media and Advocacy of the NDLEA, thank you very much for coming on the program, and thank you for your time. All right, we'll take a short break, but when we come back, we'll be speaking with a professor of sociology on this very burning issue. Stay with us, don't go away. Opinions are free, facts are sacred, but truth is universal. How, in practical terms, can we, for instance, de-escalate the tension?
President must see himself as the President of the Federal Republic.
We know where the enemy is. 3 places. The Lake Chad Basin, the border area between Nigeria and Cameroon, and then the Sambisa Forest.
On DEJI360, we give you a complete dose of everything. Opinion, facts, and undiluted truth.
I hardly believe what politicians say in this part of the world.
A new Nigeria is possible, a future is possible.
We delve into the issues, dissect it so that you can understand it, use it to take action.
I don't think there's any need for any governor to look for grant for ranching.
DEJI360, dissecting the issues.